Diabetes is a silent disruptor, often going unnoticed until significant damage has been done. It starts with whispers, small, subtle changes in your body that are easy to dismiss. But these signs grow louder, becoming more disruptive and, eventually, life-threatening. In this video, we'll explore the progression of diabetes symptoms, moving from mild annoyances to urgent emergencies. Recognizing these signs early could save your life or the life of someone you love. Mild signs. Number 1. Craving for sweets or carbs. Diabetes often starts subtly, showing signs so mild they're easily mistaken for something else. However, these early symptoms are critical signals from your body that shouldn't be ignored. One such sign is an unusual craving for sweets or carbohydrate-heavy foods. This occurs because your body struggles to efficiently process glucose, leaving your cells starved for energy. In response, your brain signals a need for more sugar, driving you to reach for sugary snacks or carb-loaded meals more frequently than usual. Imagine eating a full meal and still feeling an irresistible urge to grab a dessert or a second helping of bread. While occasional cravings are normal, consistent and excessive sugar or carb cravings can indicate an underlying issue. Number 2. Dry or itchy skin. Diabetes often begins with small, seemingly harmless signs that are easy to dismiss, but they're your body's way of signaling a deeper problem. One such sign is persistently dry or itchy skin. High blood sugar levels can cause dehydration, as your body pulls fluid from tissues to manage excess glucose. This lack of moisture leaves your skin feeling rough, flaky, and irritated. It's particularly noticeable on areas like your hands, feet, or elbows, where the dryness seems resistant to even the most nourishing lotions. Imagine applying cream daily, only to find the itchiness or dryness persists, disrupting your comfort and focus. Over time, unmanaged blood sugar can also damage nerves and blood vessels, further impairing skin health. Number 3. Frequent infections. Diabetes often reveals itself through subtle signs that may seem unrelated, but they're critical indicators of underlying issues. One such sign is frequent infections. Elevated sugar levels weaken your immune system, making it harder for your body to fight off bacteria and fungi. As a result, you might notice recurring urinary tract infections, yeast infections, or persistent skin issues like boils or fungal infections between your toes. These infections often take longer to heal, and they might occur more frequently than usual. Imagine battling an infection, only to have it reappear shortly after treatment, or noticing that minor skin irritations linger for weeks. While occasional infections are common, frequent or slow-healing ones are a red flag. Moderate signs. Number 1. Persistent headaches. As diabetes progresses, the symptoms become more noticeable, impacting daily life and signaling that your body is under significant stress. One such symptom is persistent headaches, which can occur due to fluctuating blood sugar levels. High blood sugar leads to dehydration, while low glucose deprives the brain of the energy it needs, both of which can trigger headaches. These aren't your occasional tension headaches. They often come on suddenly and feel intense, disrupting your ability to focus. Imagine waking up several times a week with a pounding headache that lingers throughout the day, making it hard to concentrate on even simple tasks. While headaches can have many causes, frequent and unexplained ones, especially when combined with other symptoms like fatigue or thirst, could indicate diabetes. Number 2. Darkened skin patches. As diabetes progresses, certain physical changes in your body may signal underlying issues. One such sign is the appearance of darkened, velvety patches of skin, often caused by a condition called acanthosis nigricans. These patches are most commonly found in areas like the neck, underarms, or groin. They appear as discolorations that resemble stains or shadows and don't fade, even with thorough washing. This skin change is linked to insulin resistance, a hallmark of type 2 diabetes, as elevated insulin levels stimulate skin cells to grow excessively. Imagine noticing an area on your neck or underarm that feels thicker or darker over time. This isn't just a cosmetic concern. It's your body's way of warning you. Number 3. Swollen gums or oral issues. As diabetes progresses, it can affect areas of your body you might not expect, such as your mouth. High sugar levels can feed bacteria in your mouth, creating an environment where infections and inflammation thrive. This can lead to swollen, tender gums, frequent bleeding during brushing or flossing, and even more severe issues like gum infections or abscesses. You might notice that your gums feel unusually sensitive, making eating or oral hygiene uncomfortable. Imagine brushing your teeth and noticing your gums bleed consistently or appear puffy and red. Left untreated, these oral issues can progress to gum disease or tooth loss, further complicating diabetes management. Urgent signs. Number 1. Chest pain or shortness of breath. When diabetes reaches a critical stage, the symptoms are impossible to ignore. These are clear warnings that require immediate medical attention. Severe hyperglycemia can put immense stress on your cardiovascular system, increasing the risk of a heart attack or stroke. You may feel sudden chest discomfort, tightness, or a squeezing sensation, sometimes accompanied by shortness of breath. Imagine struggling to catch your breath after minimal activity, or feeling an unexplained heaviness in your chest. These symptoms signal that your body is in serious distress, possibly due to complications like diabetic ketoacidosis, DKA, or cardiovascular strain caused by high blood sugar levels. Number 2. Severe abdominal pain. When diabetes reaches an urgent stage, severe abdominal pain can be a warning sign that requires immediate attention. This symptom is often linked to diabetic ketoacidosis, DKA, a life-threatening complication of diabetes. DKA occurs when the body lacks enough insulin to use glucose for energy, forcing it to break down fat too quickly. This process leads to an acid buildup in the blood, causing extreme discomfort. The pain may feel like intense cramping or a sharp, stabbing sensation in the abdomen that doesn't subside, often accompanied by nausea, vomiting, or difficulty breathing. Imagine being unable to sit comfortably due to the pain or finding it hard to eat or drink. Left untreated, DKA can quickly escalate, leading to severe dehydration, organ failure, or even death. If you experience these symptoms, seek emergency medical care immediately. Number 3. Confusion or inability to focus. When diabetes reaches a critical point, confusion or an inability to focus can be a clear sign that your body is in distress. Very high or low blood sugar levels disrupt brain function, causing symptoms like mental fog, slurred speech, or even disorientation. You might find yourself forgetting simple tasks, struggling to form coherent thoughts, or feeling like you're trapped in a haze that you can't shake off. These symptoms occur because your brain either isn't receiving enough glucose for energy, in the case of hypoglycemia, or is overwhelmed by excessive glucose in hyperglycemia. Imagine trying to recall a familiar name or follow a basic conversation, only to feel utterly lost. These cognitive changes aren't minor. They signal a medical emergency that requires immediate intervention to stabilize blood sugar levels and prevent further complications. Seek help without delay. Diabetes can be managed effectively, but it starts with awareness. By understanding these signs, mild, moderate, and urgent, you're equipping yourself to act quickly and protect your health. Don't wait for symptoms to worsen. If you've noticed any of these signs in yourself or a loved one, make an appointment with your healthcare provider today. You should also watch this video on other mild to severe diabetes signs everyone should know. And please subscribe to this channel if you find this video helpful. Thank you for watching.